There are distressing images right from the start.
In Delhi, the funeral pyres are never extinguished. They bring the bodies in on wooden planks for mass cremation. So many souls released before their time. So many deaths from a virus that many in India had thought was in decline. They've created makeshift crematoria in the centre of Delhi and other cities to deal with the seemingly endless cycle of death. Families are in shock, because if the country had been better prepared, if there had been enough oxygen, if politicians hadn't insisted on holding election rallies with no social distancing or masks, those on the pyres might be alive today. And then there's the deaths of 13 people in a COVID ward in Mumbai that caught fire last night. The hospital director said a ball of fire erupted in the ICU and smoke engulfed the ward. They've launched an inquiry. People are desperate. In Lucknow, a young man pleads with his mother as she struggles to breathe. "Nothing will happen to you, mother. Please keep breathing." And he lies down there in the hospital car park in protest and despair because he cannot get her admitted. It's the same story in Delhi. Critically ill patients are arriving at a hospital only to be turned away because the beds are full and there's no oxygen.
I've been everywhere, searching for 2 days for a hospital to get my mother admitted. I've visited all the hospitals in Delhi. They all say the same thing, that beds are not available. Another patient, my son, is at home. So who do I take care of?
My mother needs oxygen. There are no beds available, nor oxygen anywhere in Delhi. I phoned the helpline numbers. They said they don't have any beds. I went to each and every hospital in Delhi. Can you please help me?
Today, Prime Minister Modi held a video conference with chief ministers of the 11 worst affected states. He's finally cancelled election rallies blamed for some of the spread and pledged to facilitate the delivery of oxygen, but he's very late to act. Oxygen manufacturing units have been charged with doubling their capacity and working round the clock. Oxygen intended for industrial purposes is only now being diverted to hospitals. The Indian Air Force is starting to transport oxygen, and bureaucratic obstacles that bar it from crossing state lines have been lifted.
This as the Delhi government has said that no oxygen stock is left in 6 private hospitals.
But Indian TV is full of stories of those for whom this is all too late, as new variants add to the political failure to act. In much of the country, the health service has collapsed.
We probably, you see, we as a doctor, we as a hospital, we are supposed to give life. If we cannot give them oxygen even, what is the situation? When patient comes to, patient will die. Patient will die.
As night falls, the funeral pyres keep burning. After the first wave of COVID-19, the Indian government had the opportunity to prepare for a second, but it didn't. This is the result.